What are DATSCAN limitations in Parkinson's? Imagine trying to solve a puzzle about a complex condition like Parkinson's disease. DATSCAN, or dopamine transporter single photon emission computed tomography, is one piece of that puzzle. It uses special imaging to look at dopamine transporter levels in the brain, helping doctors see how well the dopamine system is working. But while it can be helpful, it has important limits that need to be understood. First, DATSCAN cannot definitively diagnose Parkinson's disease on its own. It is not a test that confirms or rules out the condition by itself. Instead, doctors relying mainly on a detailed clinical examination and history. DATSCAN is approved to help differentiate Parkinsonian syndromes from other conditions that cause tremors or movement issues, but it cannot replace a thorough clinical assessment by an experienced neurologist. Second, sometimes the scan results can be misleading. Some people who show clear signs of Parkinson's disease may have a normal DATSCAN. These cases are called SWED, or scan without evidence of dopaminergic deficit. This can happen more often in older patients or early in the disease. So, a normal scan does not always mean the person does not have Parkinson's. It highlights that DATSCAN has limitations in sensitivity, especially in the early stages. Third, DATSCAN cannot tell the difference between Parkinson's disease and other similar conditions called atypical Parkinsonian syndromes. These include disorders like multiple system atrophy or progressive supranuclear palsy. All these conditions show reduced dopamine transporter levels, so the scan cannot distinguish among them. This is important because treatment and prognosis can differ between these disorders. Fourth, the scan is not useful for tracking how Parkinson's disease progresses over time. Although it shows dopamine transporter levels at a specific moment, it does not reliably reflect changes in symptoms or severity. Therefore, doctors do not use DATSCAN to monitor disease progression or response to treatment. Fifth, because DATSCAN involves exposure to a small amount of radiation, there is a slight risk. While the risk of harm is very low, especially compared to the benefits in certain cases, it is still something to consider, particularly if repeated scans are planned or if the clinical benefit is uncertain. Finally, certain medications and other health conditions can influence the results of DATSCAN. For example, some drugs can temporarily affect dopamine transporter levels, leading to false negatives or positives. Conditions like drug-induced Parkinsonism or reversible neurological issues can also impact the scan's accuracy. In summary, while DATSCAN can be a helpful tool in evaluating movement disorders, it has clear limitations. It cannot definitively diagnose Parkinson's disease, may give false negatives especially in early disease, cannot distinguish Parkinson's from similar disorders, and involves some radiation exposure. The most important part of diagnosis remains a careful clinical assessment by healthcare professionals. Always consult a specialist for personalized advice and interpretation of any test results.